Hello. How you guys all doing? I am just here. It is June 5th, and I'm going to update you guys on the last week. So I ended up having chemo yesterday, so I am on my next round. So I am on my fourth round, and I had Herceptin, perjeta, and Taxotere yesterday, the big three. So it was the big one. I was hoping not to have to do another round, but, it sounds like this is what I'm going to have to go through for a little bit longer to make sure the tumor is as small as it can possibly be, and to also feel like everybody has gotten it down to, the smallest size possible. This was my concern, though, if it gets so small that then the side effects then just start hitting me, or the spillover is when my body takes more damage than the cancer. In the PET scan, which I think it'd be kind of fun if I showed you guys the different scans. I'll try to get it loaded and then pulled up by my computer in a way that's not annoying to look at over a video, but I'll try to show you guys, the difference, because it's been pretty cool to see. It looks good. And even in the tumor in the left breast, it didn't have much of a signal, so it was pretty low signal, which could indicate a lot of it is just dead necrotic tissue at this point. I don't want to do too much, obviously, of chemo. So either way, we're chugging along. I got to meet with Dr. Rob. It went really well on Tuesday. Sarah's mom got to visit with me. Well, she's been visiting. So she got to come to Mistletoe on Monday, my 24th round. And then she got to come to my conventional treatment and meet with Rob. So Rob is in support of me getting the surgery, even though the surgeon is kind of against it. She was sort of surprised. She thinks it needs to be case-by-case basis. And so she believes that I should have a strong enough immune system to be able to, heal and overcome this as best as a person could. So I think she's in support, because she herself said it could bloom on its own. The tumor itself could bloom at some point. And I said, and I'm worried about it, mutating. What if it mutates? What if it turns into a triple negative tumor? She said that's possible. I mean, that's definitely possible and not something I want. And she's also in agreement that it very well can move to the other breast. It very well could be a different type of cancer over there. And I mean, if it decides to charge up on the intensity level, the next most aggressive one would be the triple negative. So I would imagine it would go to that. Obviously, it could go to ER positive, but to me, that's scary as well, because then you have to start messing with the hormone blockers. And I really don't want to do that. So we're just going to chug along. She said, she put in a request for me to meet with Dr. Michelle LeBlanc, which is going to be another possible surgeon here in Asheville. So fingers crossed I get somebody in Asheville. I just got a call from them, their office. So I just got on the books for next Thursday, I think at 3:15. So that's exciting. So I get to go meet with her, and maybe she'll be on board. If not, Dr. Rob had a suggestion of somebody in town who has worked with stage 4 patients. And also I still have the referral from Dr. Hancock at the Mistletoe Clinic for somebody in Atlanta that may take on a stage 4 cancer patient. So it's interesting. I think more mainstream so far, what I'm seeing is that they don't believe the surgery will help the length of my life. They don't think it'll give me more life. They think it maybe would be less complications, barring the tumor growing back and busting out of the skin or something wild. They don't think it'll really do much positive for me, but Hancock and everybody at the other clinic thinks that that's the old way of thinking. The new way of thinking and the new research and the surmounting research, and apparently there's quite a lot that's coming out, is that getting the surgery is really important to remove the primary tumor. You want to try to get that tissue out, because they're not looking at 5 years or 10. They're looking at 20, 30, 40. I mean, they're looking at complete resolution. So Is there a danger up front? Sure. There's a danger on all fronts. No matter which direction you go, there's always going to be a danger. So I'm at least happy to know that Rob is on board with getting the surgery, especially because I'm young and she knows I want to do this so that I can, I can always do the supportive Herceptin and perjeta after, I can keep up with the maintenance doses for a while. I can't do that long term, and I can't do chemo long term. So, and I know she doesn't know about these other therapies, but I also threw in that we're not, void of other options. There's still other therapies that are out of trial stage, CAR-T, CAR-T. Looks really promising. Hancock has been talking to me about that a lot, sending me some research articles. I know somebody up there with lymphoma that's trying out some CAR-T. It's been mostly studied for lymphomas, but they have shown some positive studies for breast cancer. So that's on the rise. I had a patient that just sent me an article about a different technology they've got going on. LIT, I think, is one of them that was just mentioned. Basically, a lot of these are bone marrow. They take bone marrow out, they train it to target the cancer, and then they put it back in the body, and it essentially creates a cancer vaccine in your body that targets the specific, your cancer, your specific cellular, who knows what mix cancer, which is pretty cool. So that might be, another step. That might be another stage here if this is something that's going to drag out. I'm glad to hear the additional people coming forward and saying that they are in agreement with me to try to hit this more up front, try to get this thing, taken care of so that the upfront battle isn't super long, so that I'm too weak for the backhill battle, which I would imagine is going to be, more risky and more scary because now we have possibility of infection and things like that. But I think I'm super happy I have an oncologist that's on board. So, I am just going to keep the search. That's what you got to do. And we're just going to see when it feels right. I will say that Dr. Rob thinks that I'm in my 5th round of treatment. I'm in my 4th round, and which we recorded the session, I mentioned a couple times, did you mean 4th? I'm in my 4th round. I am now 3 months down, so I'm halfway their 6-month recommendation. I am 3 months down because I started on March 12th. She must be referring to the SpectraCell, the Signatera test. The Signatera test I did take in February, and I also met her in February, but I was pumping the brakes. I was just feeling around. I wasn't sure about chemo then. So anyway, she really thinks I'm starting my 5th round. She said, no, you're starting your 5th round. You only have 2 more rounds left, and you'll be done middle of July. Okay. Yeah. Okay. I mean, you know best. You're the doctor. Okay. I did mention a few times that I'm in my 4th round, but she believes 5th. That's fine. To me, it looked like I would be going straight through August, and that felt really long anyway. I feel like through July, obviously still feels longer than I liked, but it's shorter than August, so I said okay. I'm definitely on board with doing it, through June, and hopefully I meet with LeBlanc next week, and she's like, man, I could take this out tomorrow. Let's schedule you in a month or 3 weeks, 3 to 4 weeks after chemo, so we can get you on the books. And I'll be like, great. It's a possibility, so it doesn't really matter right now who thinks what. So I do believe after a month of conventional that the tumor will probably not even be palpable. That's what I'm hoping. I hope it keeps shrinking. I think a lot of it is going to come down to me just keeping the fluid moving, which is the thing I've noticed for the side effects list. Just after Monday, I noticed lymphedema. So I think I was clocking in at like 160. I'm at like now 170 just in a day, and that's fluid. What? So the only explanation was that we weren't moving much. We were standing still and sitting driving to Atlanta, of course. So that's 8 hours of just sitting in the car alone. And then I get there and they hook me up to an IV, and then I go outside and I carve alabaster stone because I'm in this like art class with Jessie. So I get to do this alabaster carving, which is just so fun. So I'm just standing, and then I go and sit again, and then they inject my tumor, and then I go to the market and we get in the car and go. So it's a lot of sitting. So could be that, could be the inflammation. My marker, my blood work jumped back crazy from the last week since I didn't have chemo. But some of the markers really flip-flopped, and it was a little bit weird. And the thing that my acupuncturist mentioned is it's most likely inflammation, and we're looking at, sort of this big shift. So I think a lot of it's the mistletoe. I think we just skipped that 1 week, and now we're hitting it hard again. And so my neutrophils are just wild, and a bunch of stuff's going crazy. But my body's handling it pretty well, and my immune system, at least, I have good numbers. I mean, it's also so rare to see immune system just go crazy up. Usually it's going crazy down. So that's not necessarily a bad thing. It just says that there's a lot of stuff happening. And it wouldn't be, if I wasn't doing mistletoe, I'm sure it wouldn't be like this at all. So I'm pleased, I think. So yeah, that was the big one. So I'm doing some rebounding, which is just bouncing on a trampoline. I'm doing Qigong because it's like a lot of body kind of bouncing. I'm really getting into Qigong. I found this guy on YouTube and I love him. I really like that. It feels really important to do. Good energy, good movement of energy. I am practicing these like leg squeezy things that one of my patients let me borrow. They like heat your leg and squeeze them. But man, I'm on I put it up to moderate because I thought I was like, I can handle moderate, but it squeezes really hard. I had to release it at one point. I thought it was going to choke me out. I thought it was going to either break something in me or it itself. So I'm going to stay on the level 1 on that. I will say I didn't have fluid in my legs this morning, so that was good. So they're feeling a little bit now. I haven't weighed myself, but I could have done that at the office here. So maybe I'll do that before I leave. But, I'm moving the fluid, so that's all I can do. Keep it moving. I did ask to not get on steroids any longer, if I could skip the steroids, but she said, I'd rather you deal with fluid in your legs than fluid around your lungs, which apparently Taxotere can do, which is a real bummer because I thought the whole reason I chose it was because it was supposed to be solventless. So it didn't have an oil solvent, which everybody's allergic to, which is why you have to be on a steroid. But if you don't do an oil solvent, you possibly could do it without a steroid. So that was like the whole conversation. And then here we are again, like, oh, just kidding. Everything we talked about in detail that you said and I agreed to, no. Just no. What? Why didn't you just know that? Why didn't you just say that then? Yeah, I see what you're saying, Janine. That's a logical thought process, but that's not how it's going to go. We're going to keep you on it because of the other detrimental effects that these drugs have on you, and we'll deal with the steroids and the rounding of your face and the fluid and the acne and all the other things. We don't really care about those side effects. We care about you being able to breathe. Okay, touche. All I needed was an explanation. This is communication. Why don't we do this more? That's what I want out of my healthcare system. More communication, please. Anywho, I think that's kind of the big update. It's super positive. Everybody's really excited. I heard, that Dr. Hancock literally jumped up and down when he got the results of my PET scan, which is super cool of Dr. Rob, my oncologist, to send the scan results over to the Mistletoe Clinic. I thought that was really cool. So he has definitely put her high on his list of awesome oncologists, and I like to tell her that every time I see her so that she can be flattered and, maybe notices how cool this is, because he was like, can you even believe it? This is unheard of. Not many people, end up clearing metastasis to the liver, out of all the organs, but any metastasis in 3 months. It's not very common. Granted, most of the time they do these scans after 6, so it's hard to know what they do, but I think it just shows them how fast some of these extra therapies are helping to make this more effective, quicker. And hopefully we get to this end point with the least amount of side effects possible. I'm certainly doing my part to do all the oils and all the supplements and all the stuff I'm trying to do. So that's all we can do for now. But it is pretty cool that I have a doctor that got really excited about the changes. And I do attribute quite a lot of it to the iWave, which was the hyperthermia device that I was using to heat the tumor up. I think that device helped quite a bit, especially pairing that with chemo during my treatments. I think that was just like the bee's knees. I got a lot of comments about it. But now I don't have to lug it around because I'm not as worried about the liver, which is really exciting. So I don't have the liver metastasis, so I shouldn't need to do the iWave. I am still doing like a heat pack on the breast tumor. I might do a more specific one at some point, get a little better at that. I don't know. I am still doing also DMSO, 1 drop of iodine, and some frankincense, on it as well. So hopefully we shrink it down enough that they're like, yeah, let's get this going. And then I find a surgeon that's on board. So more to update in time. I think that's pretty good right now. It's a long video for just an update. So I'll come up with a cool one to talk about in the future. I've been diving into the research on a few other of the things I've done, like methylene blue, which has been an interesting one. So I'll probably talk about that maybe next time. But I haven't been doing it lately, so we'll see what I come up with. But I hope you guys have a great day, and I will talk to you soon. Bye.